when I left BYU and went up to the University of Utah to do some more studies, I joined the faculty for a little while at the University of Utah. One of the first projects I worked on was the Utah suicide study, because Utah has been traditionally and tragically high up on the list of the top states where that's a serious concern. As we all know, the pandemic really put this magnifying glass on the state of our mental health collectively and individually in our community here in Utah and our families, where depression is the leading cause of disability worldwide. And that's a really rough condition to get, where one of the core symptoms, anhedonia, loss of pleasure in things. It kind of sucks the pleasure out of life and the hopelessness and everything that comes with it. So Utah has traditionally also ranked high in antidepressant use for a number of reasons. But I think we're right there with everywhere else in the country in realizing the state of mental health, and that it's a mental health crisis out there. But thankfully, with this psychedelic renaissance, I view it more as a mental health revolution. Like, there are these multiple things happening at once, where the stigma seems to be reducing, thankfully. It used to be taboo to talk about therapy or talk about your psychedelic experiences, but it's becoming more and more, instead of a sign of weakness, a sign of strength to go do your own work, go to therapy. But there's so much more work to do. The medicines we have aren't that effective. They leave so many people left suffering. So yeah, it's why I'm here for sure. Is there's a mental health crisis among us, and we've got to do something about it.